Hello again. This is Math 1120 coming to you from the College of DuPage. The title of this lecture is Accuracy, Sensitivity, Specificity, and Prevalence. And as always, I encourage you to be an active learner while watching this video. The reason we're having this lecture is this is a list of the learning objectives for the course. And I'm looking at this and checking off things, and we're doing good progress, and we will be finished with this list by the end of the term. That is the plan. These two columns are what we call the learning objectives, and as you look at these, you'll see a lot of things we've talked about and some things we have yet to talk about. And then you see this number 20 and 21 down here, where the topics I'm supposed to cover are prevalence of a medical condition, and in 21, the sensitivity, specificity, and accuracy of a medical test. So that's the purpose of this lecture. Emergency physicians, like other specialties, are faced with different patients in different situations every day. They have to use diagnostic tools like laboratory tests and imaging studies, like the ones you will do in ultrasound, to manage them. In most cases, numerous tests are available. Tests with the least error and the most accuracy are most desirable. The power of a test to separate patients from healthy people determines its accuracy and diagnostic value. Therefore, a test with 100% accuracy should be your first choice. Unfortunately, this does not happen in reality, as the accuracy of a test varies for different diseases and in different situations. For example, the value of a D-dimer test for diagnosing pulmonary embolism varies based on the pretest probability. It shows high accuracy in one low-risk patient and low accuracy in high-risk patients. The characteristics of a test that reflect the aforementioned abilities are accuracy, sensitivity, and specificity. These are positive and negative predictive values and positive and negative likelihood ratios. In this educational review, we will define these and calculate the accuracy, sensitivity, and specificity of some example hypothetical tests. Let's begin with some definitions. When we say patient, that means someone who has a disease. When we say healthy, that means they are negative for disease. They don't have the disease. A true positive is the number of cases correctly identified as patient. False positive is the number of cases incorrectly identified as patient. True negative is the number of cases correctly identified as healthy. And false negative, FN, is the number of cases incorrectly identified as healthy. The definitions continue. Accuracy. The accuracy of a test is its ability to differentiate the patient and the healthy cases correctly. To estimate the accuracy of a test, we should calculate the proportion of true positive and true negative in all evaluated cases. Mathematically, this can be stated as the accuracy is true positive plus true negative divided by true positive plus true negative plus false positive plus false negative. That's the equation for accuracy. Sensitivity. The sensitivity of a test is its ability to determine the patient cases correctly. To estimate this, we should calculate the proportion of the true positive in patient cases. And mathematically, sensitivity then is true positive over true positive plus false negative. Specificity. The specificity of a test is its ability to determine the healthy cases correctly. To estimate it, we should calculate the proportion of the true negative in healthy cases. Mathematically, this can be stated as specificity is the true negative divided by true negative plus false positive. Let's look at some examples. Here's scenario 1. Imagine we have a sample of 100 cases, 50 healthy, and the others patient. If a test can be positive for all the patients and be negative for all the healthy ones, it is 100% accurate. And down here you see that we get, whenever the person is a patient, they test positive. Whenever they're healthy, they test negative. This means this is 100% accuracy and sensitivity and specificity. In the figure 1, then the arrow shows the test and is being able to differentiate healthy and negative exactly. So the sensitivity of the test is 50 divided by 50 or 100%. And specificity is determined dividing the healthy by 50 is 50 or 100%. And so we have 100% accuracy, sensitivity, and specificity. That usually doesn't happen. Let's look at scenario 2 and see we have, again, 50 and 50 patients and healthy. But this is the fraction that tests negative, and this is the fraction that tests positive. So if the test can only diagnose 25 out of 50 patients, and has reported the others as healthy, the accuracy, sensitivity, and specificity will be as followed. Accuracy. Of the 100 cases that have been tested, the test could determine 25 patients and 50 healthy cases correctly. Therefore, the accuracy of the test is equal to 75 divided by 100, or 75%. From the 50 patients, the test has only diagnosed 25. Therefore, its sensitivity is 25 divided by 50, or 50%. Specificity. From the 50 healthy people, the test has correctly pointed out all 50. So its specificity is 50 divided by 100, and that's going to be 100%. So, according to these statistical characteristics, the test is not suitable for screening purposes, but it is suited for the final confirmation of a disease. Over here, in contrast, this was appropriate for both screening and final verification of a disease. Let's look at another example. This time, we assume the test has been able to identify 20 of the 50 healthy cases and has reported the others as patients. This shows what happens. So there are the patients, there are the healthy. These were the ones that tested positive. Those are the ones that tested negative. So let's calculate these again. Accuracy. Of the 100 cases that have been tested, the test could identify 25 healthy cases and 50 patients correctly. Therefore, the accuracy is equal to 75 divided by 100, or 75%. From the 50 patients, the test has diagnosed all 50. Therefore, its sensitivity is 50 divided by 50, or 100%. Specificity. From the 50 healthy cases, the test has correctly pointed out only 25. Therefore, its specificity is 25 divided by 50, or 50%. This summarizes that according to a figure. According to these statistical characteristics, this test is suitable for screening purposes, but is not suitable for final confirmation of the disease. Now we're going to turn our attention now to prevalence, and this is addressing the issue of how many people become sick each year. And we're going to be talking about the difference between prevalence and incidence. The incidence of a condition is the number of new cases in a period of time, usually 1 year. For most conditions in this table, the figure is given as the number of individuals who developed the illness or problem, and this was in the calendar year 2004. However, for some conditions, such as diarrhea here, or malaria, it's common for individuals to be infected repeatedly and have perhaps several episodes. For such conditions, the number given in the table is the number of disease episodes rather than the number of individuals affected. It's the number of new cases in a period of time. It is important to remember that incidence of a disease or condition measures how many people are affected, by it for the first time, or perhaps repeated times in terms of diarrhea or malaria, over a period of time, mostly 1 year. Incidence does not measure how many people have a disease at any given time. This is prevalence, or how badly their lives are affected. And you see, if it's prevalent, like someone who develops rheumatoid arthritis probably has it for the rest of their life, even though it started at a given year. So that is prevalence. It is how many people have a disease at any given moment. That's the kind of thing that was getting reported in the when it's talking about the number of people who tested positive for COVID-19. That's prevalence. How badly their lives are affected. So a health problem or disease can have a relatively low incidence, but can cause death or disability. Therefore, it is a high burden of disease or many lives, years lost. Conversely, some common illness may cause a much smaller burden of disease or fewer lives lost. And here's some data. And diarrhea is the most common of these diseases. It turns out this is a major thing, and although in the United States we don't have people dying from this, usually in other countries that is far from the case. And so it talks about some of these incidents and things like that. So there is a difference between incidence and prevalence. That completes our mission. So in closing, now more than ever, time is precious. Each day must count. Do the math. It will make you strong. And now more than ever, take care of yourself and of each other. God bless you all.